In this video by Deck Plate we will be discussing the condition of migraine, its types, causes, symptoms, and diagnosis. A migraine is a headache that can cause severe throbbing pain or a pulsing sensation, usually on one side of the head. It's often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Prodrome. 1 or 2 days before a migraine, you might notice subtle changes that warn of an upcoming migraine, including constipation, mood changes, from depression to euphoria, food cravings, neck stiffness, increased urination, fluid retention, frequent yawning. Aura. Auras are reversible symptoms of the nervous system. They're usually visual but can also include other disturbances. Each symptom usually begins gradually, builds up over several minutes, and can last up to 60 minutes. Examples of migraine auras include visual phenomena, such as seeing various shapes, bright spots or flashes of light, vision loss, pins and needle sensations in an arm or leg, weakness or numbness in the face or one side of the body, difficulty speaking. Attack. A migraine usually lasts from 4 to 72 hours if untreated. How often migraines occur varies from person to person. During a migraine, you might have pain usually on one side of your head, but often on both sides, pain that throbs or pulses, sensitivity to light, sound, and sometimes smell and touch, nausea and vomiting. Postdrome. This stage can last up to a day after a headache. Symptoms include feeling tired, wiped out, or cranky, weakness, muscle pain, food craving or lack of appetite. Now let's talk about the causes of migraine. Doctors don't know the exact cause of migraine headaches, although they seem to be related to changes in your brain and to your genes. Researchers believe that migraine has a genetic cause. Some of the common causes found behind migraine are stress, anxiety, hormonal changes in women, bright or flashing lights, loud noises, strong smells, medicines, caffeine and tobacco. It's important to know here that chronic pain, anxiety, and depression can all play a role in both aggravating and potentially causing migraines. Here's how each of these factors can contribute to migraine. Chronic pain conditions, such as fibromyalgia, tension-type headaches, and even certain types of musculoskeletal pain, can increase the risk of migraine. This may be due to the shared mechanisms of pain processing in the brain and the sensitization of the pain pathways. Additionally, the constant presence of pain can lead to increased stress, which is a known trigger for migraines. Anxiety can be both a trigger and a consequence of migraine. Anxiety can trigger migraines through the release of stress hormones and the activation of the body's fight or flight response. The physical symptoms of anxiety, such as muscle tension and rapid heartbeat, can also contribute to migraine. On the other hand, the unpredictability and pain associated with migraines can lead to chronic worry and anxiety. Depression is associated with changes in brain chemistry, including alterations in neurotransmitters like serotonin. These changes can influence migraine development. Furthermore, the physical and emotional toll of living with chronic pain and disability from migraines can lead to feelings of hopelessness and sadness, which are characteristic of depression. Stress is a well-known trigger for migraine attacks. Chronic stress can increase the frequency and severity of migraines. Additionally, the anxiety and depression that often accompany chronic stress can exacerbate migraine symptoms. Now let's shed some light on how migraine is diagnosed. To make a diagnosis, your healthcare provider will take your medical history, ask about your symptoms, do a physical and neurological exam. If you were an honorably discharged veteran from U.S. military and looking for the compensation you can get for the condition of migraine, please check out our other video on migraine with compensation rating. Thank you for watching our video and have a wonderful healthy life.